Hello, my name is Cynthia Clyburn, and I'm a social worker at Penn Neurology. And my role within the FTD Center is to get patients and families connected to supportive resources, whether that be resources for emotional support or resources for care planning. Following a diagnosis of FTD, patients and families have the opportunity to meet with a social worker, and this consultation can be for the purposes of care planning, to address next steps. It can also be for emotionally processing the news that they have just received. Following a diagnosis, there is really no right or wrong way to react emotionally to the news. For some people, they can experience a sense of relief as they can finally get validation or clarity, a name to their symptoms or the symptoms that they have experienced. So for some people, it's a sense of relief. For others, it's met with shock, sadness, shame, or guilt. Sometimes our patients with FTD can also experience apathy as a symptom, and this can make it challenging to emotionally process this diagnosis. So it's important to have a space for families to discuss the impact of this diagnosis and to process their emotions about it. I often talk about two forms of grief and loss that are not commonly talked about in day-to-day life, but that people who are living with FTD, whether it's the person who's been diagnosed or the family member, experience quite commonly. So one of these versions of grief is called anticipatory grief, which is a form of grieving that occurs before a potential loss. And this form of grief is often experienced following a diagnosis because that means that you are grieving the losses to come, which could be a loss in future plans, or a change in relationship, or a loss in function. And then also throughout the progression of FTD, patients and families experience something called ambiguous loss, which is a loss that occurs without closure or clear understanding. In dementia, this occurs when someone is physically present, but in many ways psychologically absent. So this is particularly relevant for FTD because oftentimes people experience behavior changes, and in many ways the person is still themselves. However, they may be struggling with some changes in their personality, and this would be a clear example of ambiguous loss. I find that giving these versions of grief or loss a name tends to help patients and families understand what they're going through and process their emotions better. During a social work consultation, we often talk about informing your loved ones of your diagnosis. This is a personal and family decision to disclose a diagnosis to their family or friends or colleagues. It's your own personal decision. However, I do encourage it because this helps you embrace your support system, and it helps reduce the risk of isolation. What I recommend is that patients and families inform themselves first prior to telling others. This way you can establish a narrative about the diagnosis and feel comfortable and confident answering questions or discussing the progression of the disease. Also, we discuss how to talk to kids and teens about this diagnosis. For many people want to keep things status quo for their children as much as possible and keep life as normal as possible. However, if you are experiencing symptoms or behavior changes, kids pick up on that. They're more intuitive than we give them credit. And so it's healthy to have these discussions about the diagnosis and to tell them what's going on. This is different for everyone, and the approach can be different for each age group. So at the end of this presentation, I have attached some resources for how to talk to different age groups, what language to use, what are appropriate emotional responses, but it's important to try to facilitate these discussions and leave room for kids to ask questions and to have an open emotional response. And by talking with them about this, you are modeling good coping skills. On another note, in terms of informing people, we talk about informing our employers or people at work about your diagnosis. For many people who have been diagnosed with a form of FTD, they are quite young and they are of working age. So it is important to disclose your condition at work if you feel comfortable. This is, again, a decision. The decision to disclose is for the individual to decide. However, disclosing at work may offer some protections for you in terms of your benefits. So if someone has FTD, they may be experiencing some symptoms which may cause them some challenges at work, and they may not be meeting their same job functions that they once did. So there's a risk for losing your job, which could mean losing potential benefits. So it's important to understand your HR or your employer's protocols for disclosing a diagnosis, disclosing a disability. In this case, some employers may be able to provide reasonable accommodations, which could mean a slight change in job roles that to meet your level of ability. It could also mean additional supervision or assistance with organizing certain tasks, changes in how you communicate with colleagues or customers. So reasonable accommodations could be provided, and that might be great because you could continue to work for as long as possible. But if that's not possible, you can also be facilitating a discussion about how to take disability leave or retirement, early retirement. So doing this in a professional, organized way that offers you some protections. Following a social work consultation, people are often asking, well, what now? What do we do now? And so in that case, we typically recommend establishing a structured daily routine that includes meaningful activities that boost your mood, that provide mental stimulation, as well as some social engagement. We also recommend proper diet and exercise, a healthy sleep routine, and that you just familiarize yourself with supportive resources for the future. Some other treatments and therapies and options for support could include physical and occupational therapy, as well as speech and cognitive therapy. And these forms of outpatient rehab or in-home therapies can offer compensatory strategies for coping with your condition. So whether physical therapy helps possibly reduce fall risk or strengthen or helps with balance, occupational therapy may be able to provide some suggestions for how to facilitate your daily routine or how to best cope with your activities of daily living and make that a little bit more functional. Speech and cognitive therapy can offer certain exercises, particularly for primary progressive aphasia, that can help with word finding difficulty or help with organizing your thoughts and give you some strategies for memory and for communication. And that goes both for the patient as well as caregivers' communication tips. There's also opportunities for participating in research. And then I always recommend support groups, family counseling, and individual psychotherapy, both for the person with FTD as well as family members, and particularly primary caregivers. During a social work visit, we often talk about how to plan for care and how to sort out your legal and financial affairs. I highly encourage, following a diagnosis, if you have not done so already, that I empower the patient to make decisions, their legal and financial decisions, and get their affairs in order early in the diagnosis. So this could mean establishing a power of attorney, creating advanced care directives or living wills, and this is very important as this will help you advocate for your own wishes. As time goes on, it may not be possible, or someone may not have the capacity to make these decisions or to speak out about these decisions. So it's important to find an elder law attorney or look through community resources, legal resources to establish these documents and these plans. You can also talk about financial planning with elder law attorneys and social workers and geriatric geriatric care managers, how to understand your assets to fund your long-term care, and then looking into options such as Medicaid long-term care if someone meets criteria, Social Security benefits if someone has lost their job and they're under the age of 65. So there are options out there, and I do encourage families to be proactive about this, even at an early stage. I will quickly go over some medical care to include in your support system. So in terms of care, your neurology team, at least at the FTD Center, we offer neurologists, nurse practitioners on the team. There's also a registered nurse. You may have a research coordinator if you participate in research, and you may also have access to a genetic counselor for both the patient as well as their family members, and same goes for a social worker. So we have a really comprehensive care team here. However, we do always recommend that you have established a primary care provider, as although we are able to meet your neurological health care needs, we may not be able to address some of the underlying a possible infection or an illness or an injury, so you still want to maintain a relationship with your primary care provider, and this will be very helpful, and especially also coordinating some outside resources such as outpatient rehab or home health care like we discussed earlier, with physical therapy and speech therapy, skilled nursing and nurses' aides that could assist with meeting activities of daily living, or skilled nursing for making sure that your medical needs are met. And then as time goes on, and as there is more of a skilled need present, medical need present, it is possible to have palliative care and hospice care, and these services are typically covered by your health insurance. So make sure that you are speaking with your doctor, with your primary care physician, or a social worker or a neurologist about when the best time is to utilize these options, and how to best receive some support both outside of the home and in the home. So I facilitate discussions about care planning and how to utilize care and support at home, within the community, and as well as facility care. I typically talk about utilizing your informal supports, so organizing your family, friends, neighbors, religious community, and really embracing them. Oftentimes, well-meaning people will say, please let me know if there's anything I can do to help you and your family. And to that, we often don't have a response. We just say thank you. I challenge all of our patients and families to have a response to that, to say, you know what, there is something you can do. I would love it if you just continued to come over for dinner every Wednesday night, or if you took Susan out to get her haircut or her nails done once a month. And you can really help your informal supports get organized through something called a care calendar. There's one website that I use a lot, which is called Lots of Helping Hands, and it's like a care calendar meets social media, and you can type in certain tasks or dates that you may need help, and you can invite your friends and family onto this website, and they can all stay in touch with you and mark off their availability. And this is just a great way to engage your supports and to alleviate anxiety, because they may not know how to help you, and so if you give them something specific, they're often likely to show up. And in terms of needing some professional supports, many of my patients and families utilize personal care attendants, which are home care aides or private care aides through something like care.com or an agency, home care agency, and they utilize personal care attendants to come into the home to provide some companionship, supervision for safety, light housekeeping, meal preparation, personal care, which could mean go all the way up to bathing and dressing, and as well as medication reminders. And you can hire these aides on your own time, so you pick the schedule. Some of my patients or some of my families use a home care aide twice a week for a few hours, and then I have other folks that use it 24/7. This type of care is unfortunately not usually covered by your health insurance unless you have something called a Medicaid waiver. So oftentimes this type of care is out of pocket or through long-term care insurance. And you should speak with your social worker about how to best afford this and what are some options to make this type of care more affordable in the home. Another option for care and support in the community is an adult day center. Adult day centers are what I call souped up senior centers. These are all day or half day social programs, and they offer a structured daily routine and engaging activities. They also have facilitators and volunteers with experience working with older adults with dementia or with behavioral challenges. So the common participant in these programs are typically in their 70s or 80s. So this may come as a challenge or be a little bit uncomfortable for someone with FTD as they are usually younger. So I often speak with facilitators about engaging the younger participants in a different way. So instead of feeling like a participant, can you engage them more as a volunteer? And you say, Susan, do you mind passing these napkins out? Or do you mind helping me set this up? Or will you sit with so-and-so and make sure that they have some companionship? So this gives the participant or the person with FTD, it gives them a sense of purpose and meaning and that they're being helpful. But it really also, they're still participating in this program, and it still offers some respite for the caregiver, an opportunity to get out and to know that their loved one is safe and engaged in a good social program. And then I also facilitate discussions about facility care, and this can be anything from a continuing care community, which offers several layers or levels of support, whether that's independent housing, assisted living, memory care, skilled nursing, and then there's standalone facilities. And many of our patients with FTD often utilize memory care facilities, but it can be challenging to find the right places. And so we look at other resources in the community, whether that's a senior living specialist or a geriatric care manager or social workers to help you find the right facility care and help you find something that's appropriate for your needs, behaviors, age, and so this can be quite the process. So it's better to facilitate these discussions early if possible, and for each person, when or how or if they want to use facility care, it's an individualized approach, and there's no clear answer to when is the right time or when someone will need to utilize this additional care. So it's best to try to have these conversations continuously with your support network and with your medical care team. And so at the end of all of this, I think I will be able to attach some additional resources, but I wanted to have some resources here. I wanted to discuss the AFTD, which is a wonderful website for care and for finding resources and finding out a little bit more information about FTD. It also has some great information about how to talk to kids and the different age groups and how to the language to use and the appropriate emotional responses. So here are some resources that you can look into on your own time. I've also created a survival guide with the Penn Memory Center for how to respond to certain behaviors at home, how to explain the current pandemic that is happening, and then it also talks about some resources for structuring your daily routine, as well as finding the right engaging activities to do at home during this time of isolation.